second. So I'm Steve Lowe, head teacher at the Oxfordshire Hospital School. Also do a few other bits and pieces nationally just to kind of provide a little bit of a background to who I am and what I do. The two other members of the team at OHS here today who support the MNIS project are Cairo Bailey, who's going to be doing the timing, and the one popping the hand up with to make sure that we stick to time. So Cairo is leader of learning for our outreach team, which is really the essence of where this project built and grew to support schools within the county of Oxfordshire predominantly. I'll come back to that in just a second. And then Daniel Lawrence, as our SENDCO and designated safeguarding lead, is the third and final member of our OHS MNIS team. We did have a fourth member of the team who worked really closely with us, and she's actually speaking this evening, and that's Dr. Helen Griffiths. So I'll introduce her properly later. Her photograph no longer appears on here, and I know she's got a camera off, and she's in and out of another meeting at the moment because she no longer works at the Oxford University Hospitals NHS Trust, but is a consultant clinical psychologist working now at Great Ormond Street Hospital. So we still have an awful lot to do with Helen, but she's no longer part of our core team within the MNIS project, but still a very trusted and valued partner of our organisation. So that's who we are. We'll provide all of the links at a later point as well. So if you want to jot down any of the email addresses or Twitter links or anything like that, the website addresses, phone numbers, we'll give you those a little bit later on. And in fact, Daniel, if you wouldn't mind popping those into the chat at some point so people have access to all of those additional links, that would be wonderful. Thank you. So this evening, the plan is that I'm going to speak to you for 15 minutes and just give you a general overview of who we are and what we're doing and what the website actually looks like. I'm then going to hand over to Helen Griffiths, who will talk for a brief period of time about the work that she has done in relation to the psychological impact of conditions on young people. And then I'm going to hand over to Rebecca Lipscomb from Beat Eating Disorders. And then I'm hoping that Samia McFarland is going to be here. I've not seen her join yet, and I did have a message from her earlier to say that she's not been feeling particularly well. So it may be Sammy, it may be somebody else from Long COVID Kids. We'll keep our fingers.
I'm here on behalf of Sammy. It's Kirsty Stanley.
Thank you very much, Kirsty. I really appreciate your time this evening. Thank you very much. Okay, so we'll be handing over not to Sammy McFarland, but to Kirsty Stanley on behalf of Sammy for Long COVID Kids. So thank you very much, Kirsty. I must remember your name when it comes to it. And then to Anne-Marie Baverstock, who's an education psychologist within the Oxfordshire County Council team, who's going to talk about the emotionally based school avoidance project that they've been working on. And then we'll do a Q&A just to finish off. One of the things just to note at the moment, I think, is that that although the resources that we've got hosted on our website are very much focused towards Oxfordshire schools. I mean, the main reason for that is that we're an Oxfordshire school ourselves and providing predominantly support for Oxfordshire schools. But I fully appreciate and am aware of the fact that there will be people in this webinar this afternoon that are from outside of the county council and not Oxfordshire people, and that's absolutely fine. You know, we're not restricting this. These resources are free and open to anybody that wants to use them. But there are some resources, so please just be mindful of the fact that there are some resources that talk specifically about the support that's available for young people within the county of Oxfordshire. So just be mindful of some of those resources as you look through the site. Very briefly, the school itself is broken down into three main settings. So we have some staff, and we're really lucky actually to have a number of staff from the OHS here this evening. I can see a number of faces from our staff team here this evening, so that's great to have them along and on board tonight as well. So we have three main settings. Firstly, the Children's Hospital Teaching Service. You can see there a picture of the John Radcliffe Children's Hospital up in Headington in Oxford, and we work across 3 classrooms and a multitude of wards, working with young people who are inpatients. These young people in the John Radcliffe are not just young people from the county of Oxfordshire. It's a regional hospital with a number of different specialisms. So we're supporting young people with their education from EYFS right up to sixth form age pupils as well at the Children's Hospital. The second sector is the Highfield Adolescent Unit Hospital Inpatients. And that's so the photograph you can see there is of Highfield Adolescent Unit. So it's a CAMS Tier 4 inpatient unit supporting 18 young people from key stages 3, 4 and 5. We obviously provide them with their education whilst they're inpatients. And just adjacent to that, we will be having opening within the next few weeks the psychiatric intensive care unit, which is an additional 8-bedded unit providing support for young people with really acute mental health conditions. The final sector, which we're here to talk about this evening, is the outreach teaching sector. And for those of you who are Oxfordshire professionals, and particularly those who are education professionals working with the County of Oxfordshire, I just want to spend a little bit of a moment talking about the outreach teaching sector, which the MNIS project really is part of. So the MNIS project is all about early intervention and supporting professionals in schools, particularly to avoid the need to call on directly services like our own that can then provide educational support if a young person is out of school for a prolonged period of time. We've got a number of referral pathways within our outreach teaching sector, which you can find on our website, which are the school's website, which differs from the MNIS project website, which is what we're talking about in detail here tonight. But we have an admissions criteria and a policy, which I've just bullet pointed a couple of those items there for you, but you can read that on our school website. So you can just about probably make out the school website URL at the top of that page there. But Daniel, if you wouldn't mind popping that in the chat for people to go to in their own time, that would be really helpful. So on the outreach teaching sector page, there is the facility to be able to download our admissions policy, the service level agreement that we have with schools, and also to make a referral through to our teaching sector as well. And all the information that's required around that sits on that page on our website. So why is there a need for outreach? I mean, a lot of what I'm going to show you and talk to you about now is really stuff that you probably are already aware of. So a useful graph here showing some statistics about persistent absence rates over the course of the last few years. The sharp-eyed amongst you will notice that there's no data on that graph for the academic year 2019 to 20, and that's because no data was collected by the Department for Education during that particular year. It was the height of the pandemic, obviously, so there were continual school closures and pupil absence, so data wasn't collected by the DFE during that particular academic year. In terms of persistent absence from school, let's just remind ourselves what that means. Persistent absence means 10% or more of school sessions missed. Now, that's at least one day in every 2 weeks, or at least 4 school weeks in every academic year. So it's quite a significant proportion of school time. National data shows that just over 1 in 10 pupils were persistently absent from school in 2021, and the main reason for that being illness. This academic year, that has increased, and it's more than doubled to just under a quarter of all pupils. It's a really significant increase from 2021 to 21-22, and then again an increase to this academic year. All of these data sets, by the way, just relate to the autumn and spring terms. So it's effectively September to April data sets, courtesy of the Department for Education. So what does that mean in any average class of 30 pupils? So in academic year 20 to 21, you would have had around 3 pupils persistently absent in any class. This academic year, that's increased to around 7 pupils persistently absent in any one class. And the general reason for that is ill health. And that's what the predominant and prevailing factor is here. So it's a significant issue for us all. A relatively new piece of legislation, statutory guidance, came out from the Department for Education and applied from September 2022, was the one shown on your screen here now. I'd really commend that you take a good look at that, working together to improve school attendance. Many of you probably know it inside out in any case, but there are a couple of really important elements to this that kind of stand out to me, which mean that the work that we're doing here tonight is really so important. And that's around sensitive conversations here for young people with physical or mental health conditions. So it's really highlighted quite significantly within this documentation. Another element relates to individual healthcare plans, which you'll hear a lot about this evening. And my apologies for this one. I have to give Ofsted a slide. It would be remiss of me not to talk about their expectations, setting aside what our thoughts and feelings are about Ofsted at the moment. It's important that we know what they're expecting, and it does have make reference to a number of elements that relate to young people with medical conditions. So please be aware of what these are. Have a good look at the current inspection handbook and make sure that you are aware and understand what these implications are. So I've referenced the paragraphs here. These slides will be sent out to you after this evening, so you can have a look through at your leisure as well. So the last slide that I want to go through before I just talk very briefly about the actual website itself is about changing cultures. And this is what's more important than Ofsted judgments is the young people in our schools themselves. They're the people who we are really accountable to. And the thing is, though, that we find, though, don't we, that reasonable adjustments just don't work. How many times have you tried something, invested time in it, thought that you had all the answers, only to find out that when you tried what you thought was going to be a great solution, that it just didn't work, that it didn't even touch the sides? But the thing is that reasonable adjustments don't work until they do work. And when they do work, when you do find the right one, it does make a significant difference. And the point of saying this is that you really have to just keep trying, keep talking to parents, keep talking to pupils, keep talking to professionals, keep talking to the wider family members. Find out what those differences are, find out what those differences can be, so that the reasonable adjustments really can work and can have that lasting effect and that lasting impact. You will find the right one. Once you've found something that works, sometimes it then doesn't work after a period of time. So you have to make adjustments to that again and change your approach. It's about changing habits and routines in schools. It's about being our own critical friends and holding ourselves accountable for the work that we're doing in schools, and making sure that our policies are inclusive, providing training and increasing understanding in our own settings, and developing the use of aspirational language so that it just becomes commonplace and it becomes the way that we do things around here. So those habits and routines are so important to us all. I realise now that I've only got 1 minute left, so just bear with me. I'm just going to change what I'm presenting now for a moment, and I'm just going to jump onto the main website before I then hand over to Helen to talk about her a little bit. So this is what the training site actually looks like. On the top right hand corner here, you get 2 buttons. Some of you may already have gone through this. You get a sign in button. I've already made an account for myself, so I can just sign in straight away. Accounts are free. All you have to do is enter your email address and a password that you create for yourself. We don't share any of this information with anybody else. All we will do is from time to time, we'll send you a bit of an update on what's on here. On the courses button on the top here, if you click on that, it will take you to all of the courses that are available for us. There are many on here already, and colleagues are going to talk through some of these this evening, and we are adding to this as time goes on. I just want to commend to you the introduction section. It's a really great place to start. Of course it is. In the introduction section, as you go through, and all of the sites will, all of the pages will show you a similar sort of starting point. You can see that they're scored through because I've actually completed each of these courses myself, having gone through and tested it all. This particular page gives you the insight into the reason, the rationale, the point and purpose, and you can use these training resources in your own school setting and context as well. So lots of video clips to sit alongside additional resources as well. On the main landing page, you will find that it says course. To the right of that, there's a tab that says materials. Click on the materials and it opens up links to many other elements of information that will be really useful to you. You have to go through the course in turn. So once you click on one, you can't go on to the next one until you said that you've completed that particular course. If you want to skip it, you can click on it and mark it as complete before you then move on to the next one. But it just gives you the mindset of having to navigate your way through the whole course before you can move on to the next particular section. So that's the way the course is presented. I'm going to stop talking now because I know that colleagues are going to take you through different parts and different sections of this. And I know that other presenters have got other time limited pressures now as well. So like as I said before, if you do have any questions, please pop those into the chat and we'll come to those questions a little bit later on at the end of the session. Can I pass on now to Helen Griffiths, if that's okay? So Helen is currently consultant psychologist at the Great Ormond Street Children's Hospital in London. And as I said earlier, one of the kind of founding members actually, and even precedes me in my time within the MNIS project. Helen.
Thanks, Steve, and hi everyone. It's great to be here. Thanks for having me. As Steve said, I'm currently at Great Ormond Street, but spent 3 years working with the medical needs in school project while I was at Oxford Children's Hospital. So I'm going to present a very brief presentation. There's a much longer version of, well, not much longer, it's about half an hour, I think, on the training website. So hopefully you can see that. I can't see you while I'm presenting, by the way, so I'm going to keep an eye on my phone for time, not for you to think I'm multitasking. So I'm going to speak a little bit about the psychological impact of having a medical condition in school and some of the resources that you can find on the training site. So part of my work with the Medical Needs in Schools project was thinking about how healthcare and education link up to better support children and young people with medical conditions right across all aspects of their life. And what really struck me was just what a huge and important role that schools play in supporting children with medical conditions. There's a whole range of ways that schools are such a supportive environment for children, and right in the centre there is identifying problems. So we know that schools are often the first place where we identify that a child might be struggling, they might be anxious, feeling low, feeling down, having a whole range of difficulties, and often a teacher, a TA, somebody at school is the first person that notices. So just recognising the really important role that schools have and how they link with the healthcare system is really important to make sure we meet a child's holistic needs. And certainly what became apparent, just talking to doctors, nurses, people I worked with in the hospital, was how little we knew about the impact of the health condition on a child's education and schooling. There wasn't often that much time and space in a consultation to talk about this. And then when I started working with the project and working with more teachers and educators, realising how hard it was for those in the school systems to get information that they needed to best support a child in school from the hospital and medical setting. And of course, throwing into the mix what we know about children and young people throughout the last few years, certainly the pandemic, is that we've seen an increase in mental health difficulties. And a child with a health condition is more than 4 times likely to have a mental health condition too. So a really vulnerable population in terms of our need to get the support right. So those of you that have worked with children with medical conditions, probably most of you, if not all, will recognise some of these impacts, and I'm sure there will be many more that you can think of. So we often think about a medical condition in terms of missing lessons, so for hospital appointments, unplanned absences through feeling unwell. But what is the knock-on effect of that in school? So we know feeling different, missing out on those social experiences, playing catch-up constantly, maybe not understanding what a current lesson is about if you've missed the previous, but also the impact of the symptoms themselves, so reduced sleep, cognitive functioning, reduced attention, concentration, looking different possibly, visible differences and invisible differences maybe can be tricky in different ways when perhaps people are unaware that you might be dealing with a difference arising from your health, and the result in answering questions, feeling stared at, feeling different, and as I said, an increase in likelihood of mental health difficulties. So getting it right, so understanding for that particular child and the family, what are the holistic needs of that child and what is the impact on education, and getting the right information that you need from the medical team is really important. And there's been a huge amount of research done into this. We know that children with perhaps on paper what we might think of as a more severe condition don't always have the greatest psychological impact, and children with perhaps less impairing or less life-threatening conditions might have a greater psychological impact. So being really open and curious for that child and that family, what does their health condition mean to them? We know that there's a huge range of factors, systemic factors, family factors, poverty, discrimination, lots of different factors that feed into the psychological impact of health. So trying to understand that is really important. We know that if we get the mental health treatment right, that also has a positive impact on physical health. So if you think about a time where you've felt down or tired or stressed or anxious, much more likely to forget to take our medicines, much more likely to do the exercises we've been asked to do. We're much more likely to have unplanned admissions, unplanned appointments because of our mental health. So we need to really consider the reciprocal impact of physical and mental health on one another and in the education setting. So we know that despite this, children and young people are incredibly resilient, and they're also very good at masking, particularly as children get a bit older, saying, yeah, I'm fine, I'm okay, but looking out for those signs that actually things might not be fine, particularly those kids in classrooms that are quiet and might go under the radar. And it's really important to get this right, because we know 75% of mental health difficulties have their onset before the age of 25. So this has a real impact on longer term physical and mental health outcomes. These are some of the asks that might be made of our colleagues in education settings. Really difficult to accommodate some of these when you're working in a busy school, under-resourced, not enough time to go around, not enough space to go around, and the many asks of the kids in your school. So understanding why these are important, which of these might be preference with the parent, preference with the family, which of these align to medical advice is really important. But we know if we get this right, if we can come together as a team, a multidisciplinary team, the hospital, the school, the psychologist, CAMS, putting the child and family at the heart of all of these services that surround a young person, we can get some really positive impacts of working together. So reduced effects of the condition, reduced absenteeism, increased social and emotional development, and so on. So getting it right is a common goal for us all. Steve talked about some of the guidance. The supporting pupils with medical conditions is one of my personal go-tos. It sets out really clearly the responsibilities of not just education colleagues, but also healthcare colleagues in being part of the conversation, part of the support around a child at school, and the expectations on us in healthcare to really provide the information and dialogue needed for schools to appropriately support pupils. So do go and have a look at it if you've not seen it or not familiar with it. And one of the core aspects of this is something called an individual healthcare plan, or an IHP. And for me, clinically, it's a really, really important document to co-construct with schools, with the child and family at the heart, thinking about the physical and psychological impacts of the health condition in education, what information we need, what are the reasonable adjustments and supports that we need to put in place. There's a much longer training session on this on the website, but just to share some examples here of how I write up an IHP that really clearly sets out what the adjustment will be, why it's needed, and who's responsible for it. And of course, reviewing this is really important. That's done regularly to make sure the child's needs are reviewed and met. So just in terms of getting it right, I suppose some top tips I've learned along the way and that I've learned from colleagues and having conversations with colleagues, being curious about the holistic impact on the child and the family. So parents that are maybe asking for lots of adjustments or adjustments that seem sort of over and above what the medical condition might indicate, thinking about what is that saying, what's that communicating, where's the anxiety around this? Having those conversations early and not being afraid to have open and curious and compassionate conversations about that child's needs and the family's needs, and getting a shared understanding and being on the same page. And that can be best done by developing, as far as possible, a relationship with the family and the child, not wait until problems develop and really trying to understand what it's like. Identifying who you need to get information from, if you've got any concerns about what a child can and can't do as a result of their condition, what adjustments need to be made, and getting early contact details from the medical team, getting consent to share letters and so on before difficulties arise. And really collaboration and partnership is at the heart of this, putting the IHP together with the child right in the middle, as part of all of the conversations, with regular reviews and refining the plan in place to support the child. That's a really quick whiz through. I hope it somewhat inspires you to have a look on the website at a longer version of this. And you might also hear some other Welsh lilts on some of the other videos too, particularly around supporting young people with cancer if you have a look at those resources. So I think I've done pretty well with time, Steve. I'm going to stop sharing and hand back over to you.
You've done amazingly well with time, Helen. Thank you for doing that. I said to Cairo earlier, the two people that are likely to go over time are me and Helen, and I've lived up to that. So well done. I took your name in vain. Apologies for that.
Thank you, Steve.
Thanks very much, man. Really appreciate it. Can I hand over now then to Rebecca? Rebecca's a representative from Beat Eating Disorders, a national charity with some amazing resources that I have to say are part of the inspiration behind this, actually, because some of their online learning resources are really exemplary. So without further ado, and big that one up, didn't I, Rebecca?
Yeah, I know.
Let me hand over to Rebecca from Beat Eating Disorders.
Hi, everyone. I'm just going to share my screen with you. Hoping. Cool. So yeah, hi, I'm Rebecca, and I'm here to talk to you about SPOT, which stands for Schools Professional Online Training. Don't feel like you have to quickly try and write that down. The links are all on the website, and you can find them later on. So yeah. Cool. So what is SPOT? As I said, SPOT stands for Schools Professional Online Training, and it's Beat's e-learning platform designed for school professionals. Pre-pandemic, we used to do a course in person where you would sort of send a representative from a school to, it was kind of like a holiday in a conference room, and you would learn for a day, and then the idea was that you took back, that one representative took back and sort of disseminated the information throughout the school. When the pandemic hit, we realized that this wasn't something that we could continue to do, and we wanted to look at kind of new ways of working and like how the world was changing. So hence where kind of the online platform came for, and a bit where the SPOT name comes from. So it used to be called Spotting the Signs, but it also very nicely fits in with School Professional Online Training as well. So who can access SPOT? So we've said school professionals, but SPOT is fully funded in the UK for all primary and secondary schools. It's completely free to access. All you do is go to the website, create an account, complete sort of a little sign up pre-evaluation survey kind of thing, and then you will have access. When we say school professionals, we mean anyone who works within a school capacity. So we wanted to keep this kind of as vague as possible. So we've said this includes obviously like teachers, DSLs, but also kind of lunchtime staff, school librarians, and anyone that works on a one-to-one or group basis within the school. So that does include kind of school nurses, safeguarding officers. We've kind of phrased it as if your main part of your job is within a school, we will allow you access to it. We kind of want to keep it as broad as possible, so as many people as possible are using the platform while we have it. So yeah. What does SPOT have to offer? So like I said, it used to be a course pre-pandemic, and there used to be kind of a learning aspect to it, but something that people took away from the in-person stuff that we don't get so much when it's an e-learning platform is kind of the support and engage areas. So having people to talk to, being able to share experiences and things like that. So we knew when we were creating this platform, we wanted to make sure that it covered all of the areas and wasn't just a basic e-learning platform. So we do, of course, have e-learning modules where you can learn about sort of different eating disorders, as well as some PSHE resources, which I will go into a bit more in a bit. But we do also have kind of forums and chat rooms to discuss with clinicians, lived experience trainers, other school professionals, and we have workspaces where you can sort of discuss with like-minded professionals about your experiences, ask any questions. So trying to keep the learning and the knowledge side of things, of course, but also making sure that we are connecting and always speaking with people about issues that are going on so we can learn from each other. Yeah. So I'll just go through each of these areas in very small detail, and then I've got a video that kind of goes over it a bit more in a little while. But so we've got the learn section. So we've got, as you can see, some e-learning modules. This is just an example of a few of the ones that we have on the platform. You can see there's supporting pupils at primary school and secondary school. So we've tried to tailor the platform to what you tell us when you sign up. So like I said, there's a sign up form when you sign up, and it'll ask you some questions. For example, one of them will be sort of what age do you work with? And this will be assigned to you, whether you're working in a primary setting, a secondary setting, whichever setting you are working in. However, you can see at the top, there's kind of the Your Learning and the course catalogue. The course catalogue will have all of the modules in. So if you are someone, for example, we know school nurses can work across a number of different schools. If you are like that, you do have access to everything on the platform. It just won't be assigned to you, so you would just go to the course catalogue and sign up in your own time. But yeah. We also have PSHE resources that are completely free to download, and you can use them as you wish. There are lesson plans, there are toolkits, there are PowerPoint presentations, and we've tried to keep it with an idea around sort of eating disorders being the main focus, but also general mental health and wellness. So we've got kind of the lesson plans, which will break down, spend 10 minutes on slide 5 and have a discussion with your class, and it's really split up into that, so it should be really easy to just download all the documents and to actually just go into the classrooms and use it. That's the idea. Anyway, and they've all been written by clinicians that work alongside Beat, so they are all clinically sound. And yeah, that's the learn side of things. We've also got a support, so we've got a chat with the experts. So each Tuesday, it says each Tuesday at 12 p.m. This is actually a bit outdated. We've changed the time to 4 p.m. Now, but we have a chat with the experts, so you have the opportunity to speak with one of our clinicians in real time, where they can offer you advice, support, speak about more specific situations that you're going through. We have clinicians that work alongside Beat and are freelance. They'll come in there for an hour every week, and you have the opportunity to discuss whatever is going on for you completely. Yeah, it's completely up to you to use it. We also have other means of contact that I can mention before. We've got forums, so we've got a number of different forums on a number of different subjects. But we've also got forums that you can do the same thing as the chat with the experts, but if you can't make it at that time, you can post to one of our clinicians. We have a lived experience trainer who is someone who works for B and has lived experience, so now wants to help and give back. So they'll come in and answer it from kind of a lived experience point of view. And we also have sort of chat rooms, so they work exactly how you would think a chat room would work, but you can speak to other like-minded individuals in similar settings, or again, like I said, the clinicians are there to speak to as well. We then have the engage area, which probably support and engage sounds quite similar, which it does to me as well, but it's slightly different. So that we call the engage our workspaces areas. So you'll have access to kind of areas where you can share resources and information. So we ask you to complete, like I said, a pre-evaluation survey where you'll give us some information, very basic information about yourself, but kind of like the roles that you're working in within your school, the ages, that kind of thing. And then you'll be automatically allocated to workspaces. You can leave these if you don't want to stay in them. They're completely up to you, but you will automatically be allocated into them. And they're kind of areas. This is a bad example because it's all staff, so it's the one with everyone, but we do have them specific to sort of school nurses, pastoral staff, things like that. And it's a space, I kind of see it like more of a Facebook space. So you can share resources. If you've got a particular video that's really beneficial and helped you, you can share that to all of the members in your workspace. You can ask questions, you can seek advice. They're really good ways to kind of keep connection going with similar people to you. That was a really quick overview that I've just given. I'm just going to show this quick video. I think it's 3 minutes, and I'm really hoping the sound works. It did in practice, so hoping it works. But yeah, it just gives you a little bit of an idea of what the platform actually looks like and how the functionality works. So I'll just play it.
Welcome to this demonstration video of Spot, which is Beat's new online training platform for school professionals. Beat have developed this training for schools, as whilst eating disorders can affect anyone of any age, school-age children are a particularly vulnerable group, making school staff ideally placed to spot the early signs of an eating disorder. During this video tour, I'll give you a little bit of an overview of the different features of Spot, including the interactive e-learning modules, opportunities to speak to Beat clinicians and other sharing spaces, and downloadable resources as well, such as PSHE lesson plans and PowerPoint. So if we firstly take a look at training, on Spot you can find interactive e-learning training for school staff by clicking on either the My Learning tab or on the course catalogue, which gives you access to all the available e-learning modules to complete in your own time. The different training modules available cover many topics where staff will be taught how to spot the early signs of an eating disorder, how to talk to a pupil who may be exhibiting signs of an eating disorder, and also how to support pupils and their parents and family. The e-learning also encompasses a range of bite-sized interactive videos as well, which have been developed and delivered by our expert eating disorder clinicians. Additionally, as part of the e-learning modules, you'll find further downloadable resources such as PSHE lessons, which have been designed by our eating disorder clinicians. If you click into files, you'll find resources such as lesson plans and PowerPoints, which cover the topics such as eating disorders, body image, and self-esteem. Another way to find and share resources is through our workspaces. So when you sign up to the online training, you'll be able to connect and share resources and ask for advice with other school professionals. You can post on discussion boards and also share resources within the library, which you can find from the workspaces. And these resources can also be found from the homepage under the More Resources tab. Finally, Spot also encompasses other spaces where you can connect with others through either forums and chat rooms. So this includes opportunities for school professionals to post questions on community forums, to share advice with their peers, but also you can talk to either a lived experience ambassador or one of our clinicians as well. In addition to this, you also have chat rooms where you can join our weekly question and answer sessions, which are run by a clinician through our live chat rooms. And you can also join any other chat rooms that may be of interest to yourself as well. Thank you for watching this short tour of Spot.
So that's pretty much everything from me. I have said any questions, so if there is any, please feel free to put them in the chat and we can answer them at the end. But thank you for listening.
Brilliant. Thank you so much, Rebecca. Like I said, a great set of resources. And you'll see that what we're trying to do here is to create a one-stop shop with links to all manner of different resources for schools to support with young people with medical conditions, be they mental health conditions or physical conditions. We're not trying to reinvent the wheel here. There are people far cleverer than us with specific specialisms in each of these particular areas that we are just using effectively to bounce our site towards their resources. So thank you very much, Rebecca, for that. Can I introduce Kirsty Stanley now from Long COVID Kids, who's going to talk about some of their work as well. Again, an exceptional piece of work that's been done by Long COVID Kids. Kirsty.
Thank you, Steve. Let me just try and share my screen. Oh, it says I must grant permission. Bear with me. Technology is great when it works, isn't it? Select window. Entire screen. No, it's not letting me. That's great.
Oh, yeah.
I mean, I can talk through the slides and then I can share them with you afterwards, if you like. I mean, yeah, let's do that. Okay. So obviously I am here presenting on behalf of Sammy McFarland, who is our CEO, and I am the health lead and occupational therapist from Long COVID Kids. So we are a grassroots organisation. We were established in autumn 2020. The majority of us working in the team currently either have long COVID ourselves or obviously have a child with long COVID. We became a registered charity in autumn of 2021 in England and Wales, and we've literally just become a registered charity in Scotland as well. And our sort of goals are around connection, advocacy and signposting, and obviously improving health and learning outcomes for children, as well as obviously looking at the best possible treatment options as and when they come. So we're involved in lots of research. And one of the strengths of our charity is that we're kind of embedded into the heart of the community and have been since the start of the pandemic. So we work closely with children, young people and their families, professional organisations, including the World Health Organization. So Sammy's on the expert advisory panel there. And we're currently, for example, reviewing their document, which is about support for adolescents with long COVID. So when we asked children and young people to describe their long COVID, they sort of overall told us that long COVID is draining, depressing, exhausting, scary, horrible, intense, vicious, and never ending. It makes them feel ill, sad, hurt, lonely, dizzy, and they're in pain. So what children and young people need is to be listened and believed, to have understanding, to be asked what will help them, and to be supported to be able to access their education, engage with learning, interact with their friends, and obviously improve their mental health and social well-being. I've got a slide here that you can't see that has lots of quotes from parents about things that they said will help at school. So things like having an exit card so that they can leave the classroom with no questions being asked, allowing some flexibility around homework deadlines, getting a note from teachers if they're out of school for a long period of time, and being supported to kind of continue to connect with their friends. Pacing is really important. So looking at appropriate amount of lessons that they attend during the time, and not kind of pushing them beyond that, because there's a lot of challenges around sort of post-exertional symptom exacerbation. So children can seem quite well, and as one of your colleagues said earlier, they mask quite well in school, and then it's sort of when they get home, or the next day or the next couple of days, is when they get their sort of crash of symptoms. So in terms of support, our Shining a Light on Long COVID support guide was a huge piece of work for us last year, and we're currently in the process of updating that. Once we have updated that, that will be the last update we do to that as a whole entity, and then we're going to focus on more sort of bite-sized PDFs, so people can kind of create their own resource depending on what their child's long COVID, or what the child that you're dealing with long COVID looks like. So within that, we've got sort of guidance on commonly occurring syndromes. So, for example, we have a number of children being diagnosed concurrently with MECFS, with mast cell activation syndrome, with pediatric acute neuropsychiatric syndrome, and postural orthostatic tachycardia syndrome. Then we've got a section for parents, we've got a section for young people, and we have got a section sort of aimed at teachers that was kind of looked at by our educational psychologist on team and myself as an occupational therapist, which we hope gives really practical advice on what you can do to support kids in the classroom. So some of our other resources that you may have seen floating around are sort of a cautious tortoise, which is around sort of the early advice and signposting, not pushing children to go back to school if they're still unwell, and sort of looking at when they are appropriate to go back to school. And then we've got our pacing penguins, which really talks about pacing as a strategy. And then we also have in development at the moment a Long COVID Kids educational toolkit. And this is a series of educational videos aimed at educators, teachers and schools. It's going to be professionally produced. It will centre lived experience and the voices of children and young people and their families. And again, hopefully offer those practical tips for supporting children and young people with long COVID in and out of school. So like Steve was talking about earlier, those reasonable adjustments and, options for alternatives if the ones that we're putting in place aren't working, first of all. Again, this will be free to access, and the titles that we have at the moment, being aware that this is draft, is What is Long COVID? Understanding Readiness to Return to Education with Long COVID and the Available Alternatives, How Long COVID Affects Education in the Family, Support in the Classroom, and a Best Practice Summary. And we will also have an additional video aimed at peers of children and people with long COVID, which we're going to get some of the children to do the voiceover for that one, so they can talk directly to their peers about what they need from them. So one of the biggest things that our families are facing are huge sort of obstacles and challenges in all areas of life at the moment, including healthcare. So we're aware from sort of recent surveys that we've done that families are waiting on average about 6 months to be seen by long COVID clinics, if they do get seen at all. So we do know that some clinics if the child is attending school, even if it's not even if it's part-time, then they're not seeing them in the clinic. So then they're left with no additional support, which is obviously a challenge, but it's, you know, to do with funding and capacity, I guess, at the moment. And then obviously another survey that we've kind of looked at shows the impact of reinfection on worsening symptoms of those with long COVID. So a lot of our campaigning has been about improving air quality within schools. So considering CO2 monitors, ventilation, and air filtration. Obviously, this is a new area for all of us. We're learning as we go, and learning from other post-viral conditions, including ME. There isn't a one-size-fits-all approach to supporting children, so we really need to consider each person as an individual and look at their needs. And obviously, our team can provide signposting support and consultancy for individual cases if needed. Okay, I won't play the video from Liz. And in terms of other support, then we have a Facebook group, which is just for parents. And then we have a chat box, which is an online chat system that people register for, and then the children can chat to each other. And then we have Zoom sessions as well. So we have a 12+ session, which is now led by two, a 16-year-old and an 18-year-old, with obviously us as backup if needs be, if there's any safeguarding concerns. And then we have a 6 to 11 book group, choir, and lots of other things for the children to get engaged with if they're off school or unable to access sort of face-to-face social things. Cool. Any questions?
That's brilliant, Kirsty. Thank you. The booklet that Kirsty mentioned before, Shining a Light on COVID, I'm so sorry that your presentation didn't work and you couldn't share. Let me just share it on my screen again now with you so that you can take a quick look at it. I did share bits of it, and I hope it wasn't too much of a distraction, but just to give you a bit of a flavour for what Kirsty was talking about. So this is the booklet that she's talking about that's accessible on Long COVID Kids website, and that we provide a link to from our own site as well. There's some great stuff in this booklet, and a complete section for how to support staff in schools as well. And I'd also commend this to you for if you're working in a school and you've got young people with chronic fatigue or ME or any number of those other conditions that Kirsty mentioned there too. And I'm not going to try and remember everything that Kirsty said there, but that there are many conditions for which the approaches within this particular handbook are really relevant and very valid, as there are with so many of the other elements of work that we're talking about here. It's about inclusive practices, and it's just about, you know, trying different things until you get it right. But thank you so much for that, Kirsty. Really valuable insight. And like I said, I'm so sorry that the sharing didn't work. But have a look at the training site that we've got before, and you'll probably be able to see and find actually one of the videos that Kirsty was talking about as well, because we have linked to a couple on the Long COVID Kids YouTube page as well. So you may well find what Kirsty was talking about there.
I'll send you the slides anyway so that you can share them if you want.
Perfect. Thank you. So our last speaker this evening is Anne-Marie Baverstock, who's a colleague. We've been working as a school with Anne-Marie for some time now, although she's not our designated EP currently. But Anne-Marie is an education psychologist working for Oxfordshire County Council, and he's going to talk to us now about the emotionally based school avoidance materials that OCC have been working on. Anne-Marie.
Yeah, hi. Really nice to be here. The EBSA, so emotionally based school avoidance materials that we've put together in the educational psychology service, which Steve is kindly hosting on here. It's also placed in other parts of the OCC local offer and so on. But there are 2 videos that are on the how do you say it, Steve?
MNIS.
MNIS, thank you.
That's how I say it.
Yeah, MNIS. Okay, on the MNIS website, and there's some really brilliant courses on there. So these are to support schools in understanding. There's an introductory video about EBSA, including sort of the definition, thinking about predisposing factors, risk factors, and an overview of a push-pull framework, which is something that we use to think about what's pushing a child away from school, pulling them to home, and also what could pull them to school and kind of push them in the most positive way back into school. And that's a 22-minute voiced PowerPoint course. It was something that was put together during the pandemic, but it had been in preparation before the pandemic came. And I guess in a way the pandemic helped us put it into video format, whereas previously we probably would have created a training that people could have delivered in person, whereas now we've got these bite-sized training pieces available. The second course builds on the first one, and it's very much about thinking about how schools can identify those who are at risk of EBSA, and has to think about the level of different sort of level of intervention, and also signpost to some alternative provisions that can support children when they're experiencing EBSA. So there's lots of information on those videos about the universal way of thinking about what, you know, the kind of identifying children in the first instance who might be at risk, and that's about maybe being late, maybe talking negatively about school, right through to those who aren't attending school. So there's a kind of sort of spectrum of things to notice, and you know, you'll know those children, but there are some early signs that are really useful to look for, and then through to targeted approaches, but also thinking about the bespoke packages that some children might need. And you know, we hope as we get our heads around this area, which has sort of unfortunately burgeoned since COVID as well, because I think you know, there are some children who it really had a much easier in some ways time being at home and learning online, and that's become kind of, I've had conversations with families saying, but that's going to be the way of the future, why can't we do it that way anyway? But actually there are lots of parts of school that are more than just the content of what you're learning. It's the social, the emotional side of it too. So I really commend you to watch the videos. I have nothing to do with making them, so I'm not trying to sell my own stuff. There are some leaflets that we put together for primary school and for secondary schools, and they're on the Family Information Service directory, which I'm just going to share the page there for you. But also, if you have a link EP from our service, but also from other services, education psychologists are really well placed to talk to you about how your organisation can respond and support children and young people who are experiencing EBSA. Please talk to them and arrange a discussion. I did a recent one in the secondary school just with the pastoral team to have a think about how they approach and have those discussions with families in a really sensitive way, and that was mentioned earlier about sensitive conversations, and that was really positive. And actually one of the outcomes was that there aren't attendance letters being sent anymore, there are conversations being had in the first instance, and that was a really, really sensitive and compassionate way that the school have responded in understanding kind of the absentee issues with some children. So mine's very brief, no whizzy PowerPoints or anything like that, but please watch the videos, they're really, really useful. Thank you.
You're on mute, Steve. Steve, you're on mute.
And I was saying such nice things about Anne-Marie there as well. Thanks, Cairo. Yeah, thank you very much, Anne-Marie, for sharing that piece of work that the OCC EPs have completed. There's some really strong stuff that's out and about there at the moment, and that offers colleagues within the County of Oxfordshire a local flavour to the level of support that there is that's out and about there. And Anne-Marie and her colleagues, as she described there, will obviously be very happy to come and provide some on-site support if that's what you need. But I just go back to one of the reasons why we wanted to create this training site. We were hearing lots of comments and getting lots of feedback from schools across the county saying that people just didn't know what to do and where to go and how to work with young people with all of these various medical conditions. And it became really clear that there were lots of people with a lack of knowledge, lack of understanding, and as a result, a lack of confidence around what was needed to support young people. So that was really the genesis and the the birth of the MNIS training site, really. And I think so many people have talked about the fact that they did webinars on each of these individual elements, and then through COVID found that actually people wanted it all on demand rather than at a time that it was being put on. So we created the training site. So from our perspective, it's all about sharing this information now and making sure that people are aware of where it is and what support there is that's available. And we will continue to increase the amount of information that's on here. And if anybody ever has any particular medical conditions that they're not aware of how to support young people with, then please get in touch, because if we don't know, we certainly have access to people who may be able to answer those questions for us. Have there been any questions that have cropped up during the course of the session, Daniel, at all? Is there anything that we need to go back to, or does anybody have any questions that they want to pop in the chat now?
There's none so far in the chat, just a question about the recording, which I will send around as soon as I can, but it does take a little while, so it might be next week.
Thanks very much, Daniel. Are there any other questions that have just cropped up during the course of the presentations this evening? In which case, I can only assume that the presenters covered everything perfectly. Let's take that as a message from this evening. Thank you so much. If you want to get in contact with us after this evening's presentation, if you've got any particular cases that it's clearly, in terms of the confidentiality of the circumstances of the young people, not appropriate to share here and now, then by all means get in contact with us. The contact details are on the training site, also through our own school's website as well. But that's been really valuable this evening. Thank you so much, everybody, for joining us tonight. I hope you found it helpful. Thank you.